Hello, my name is Susan King, and I'd like to welcome you to my presentation on the moral right to healthcare. Merriam-Webster defines the word moral as of or relating to the principles of right and wrong behavior. While the Code of Ethics set forth by the AMA states that physicians reserve the right to choose who to treat except in the cases of emergencies, it also states that a physician should be aware of the rights of the patient. Our patients have the right to receive medical care necessary for the treatment of their active illness and preventative services. The primary focus of the Code of Ethics for our facility is to maintain patient welfare. In order to follow the Code of Ethics as it is written, it is the duty of our facility and its physicians to ensure we meet our patients' right to health care. A moral right to health includes health care and various other determinants of health, some of which may not fall within the traditional health sector. We will discuss some of the considerations and laws that need to be met while ensuring health care rights for all patients. The first consideration is cultural competence. Cultural competence is a key component to our ability to provide appropriate medical care for our patients. Many cultures have different expectations and preferences to what care they receive and how it is provided. Our physicians and healthcare workers need to ensure that they are educated and aware of the patient's cultural preferences while still following the laws and guidelines set forth by our facility. Providing cultural competence to our patients will reduce unintended, perceived prejudices and discrimination for our patient population. While it's important for our practitioners and healthcare workers to be globally aware of cultural preferences, the training provided to our employees for the upcoming fiscal year will focus on the larger cultural groups in our area. Those groups include the Hispanic, Latino Americans, and a large Muslim population in Phoenix. That will be the primary focus of the provided trainings. Stark Law is a legislation that was passed in 3 phases starting in 1989. Phase 1 of Stark Law was passed to ban self-referrals for clinical laboratory services under the Medicare program. Phase 2 was passed with the Omnibus Budget Reconciliation Act of 1993, which expanded the restrictions to include both Medicare and Medicaid. Phase 3 had 3 major changes to Stark Law. The first being the inability for physicians to lease or charge per-click payments to hospital physicians for the use of leased or owned equipment if the owner, lessor, physician will be referring patients to that hospital. The second part, CMS prevents percentage-based arrangements for the lease of space or equipment between DHS entities. And finally, physicians are prohibited from under-arrangement transactions with referring physicians. Basically, Stark Law boils down to the prevention of physicians referring patients to other doctors or facilities in which the referring physician has a financial gain. Ethically, it's our responsibility to ensure that our patients are receiving the appropriate and necessary care to treat them while ensuring that we are meeting the guidelines set forth by Stark Law. We will not tolerate non-compliance with Stark Law. Physicians can have legal actions taken against them for not following Stark Law, and they risk termination from our facility for knowingly or unknowingly providing inappropriate patient referrals. Finally, medical malpractice. Patient safety is our #1 goal in the prevention of medical malpractice. Our facility has created numerous guidelines, policies, and protocols in order to prevent medical malpractice. According to Bastillos and Velick, a 2010 study showed that there was a 35% rate of wrong-side craniotomies performed prior to that study. Research showed that the majority of the wrong side errors were related to a failure to follow policy, guideline, or protocol, as well as a lack of communication. Preoperative measures and all protocols must be met for our patients to receive the care and services they need and deserve. It is our duty to ensure we do no harm while treating these patients in some of their most vulnerable times. In conclusion, for our facility to remain one of the best providers of patient care in Phoenix, it is important for us to continue to ensure that our patients have access to the healthcare services that they have a moral right to receive. This can be completed through knowing, understanding, and providing culturally competent care for all of our patients, especially the two largest groups in Phoenix, the Hispanic, Latino American, and Muslim populations. We need to uphold Stark Law regulations, which ensures that our patients receive fair care and treatment from their physicians through the prevention of referrals to facilities or physicians in which there's a financial agreement. And again, finally, we need to follow the policies, guidelines, and protocols to reduce and ultimately prevent instances of medical malpractice. Thank you for your time today. I will now open the floor for questions.